advocacy and community pediatrics. And currently I practice as a doctor for the Roseville School-Based Health Center in the Division of Community Pediatrics of Georgetown. So I live in Washington, D.C.
Great, thank you so much. All right, before we begin, I would like to thank our amazing doctors for taking time out of their day to be here with us. And let's get started. Our first question is, why did you choose medicine plus pediatrics?
Who do you want to start?
Any of you can begin talking.
Okay, I'll just go ahead and start here. Actually, as cliche as this sounds, the reason I wanted to go into medicine is because I wanted to help people. When I started college, I wasn't exactly sure how I was going to do that. I thought about physical therapy, and the way I got into medicine is that after reading my personal statement, my advisor for college said, Ms. Henry, I think you should take Biology 101. So I did. And everyone in that class was an aspiring physician. So in a sense, it was like positive peer pressure. I thought to myself, you know what, if everybody else can become a doctor, I can do that too. And so that began my journey into medicine. Now, what distinguishes me a little bit from everybody else on the panel is that I'm a family practitioner, not exactly a pediatric doctor, but I do see kids starting age 5 and up. And so I see quite a few pediatric patients. Most of my pediatric population, those are teenagers, specifically teenage girls. And so that's how I got the idea to write my book.
I can go next. So I always wanted, similarly, to do something that helps other people. I wanted to be a doctor when I was young. I was kind of dissuaded from it because I was told that I couldn't have, you know, a family and children if I went into medicine because it would take too long and who would want to marry someone, you know, when they're in their 30s. So I sort of similarly took the same desire to do something good and looked at other fields that I thought I could do stuff with. And I've always known I wanted to work with children and help children and help underserved children. So I looked at social work and, you know, law and guardianships and all these different things. And in the end, I just sort of went back to medicine because it was the one thing that I felt sort of fulfilled my desires to help people, but also, you know, the fact that I love to learn and I love to continually learn. And I think medicine is one of those great fields where you have to constantly be kind of keeping up to date or you get left behind. And then, you know, pediatrics was kind of a natural fit. I briefly thought about doing OBGYN for the same sort of ability to help people who really need it. But then I realized that I was always more interested in the baby than I was in the mom who was delivering. And so I just, from the beginning, knew that that's kind of where I was going to be. So that's me.
Hi, so it's Dr. J. So I guess it's my turn to answer. I am similar to the other docs. I always knew I wanted to be a doc. I knew as early as like 3 years old. I was that little girl who saw a nursing uniform and told her mom that she needed to change it into a doctor because that's what I really wanted to do. Nothing's wrong with being a nurse. I think we have wonderful teams in medicine and we need everybody involved, but I just knew I wanted to be like kind of the leader of the ship, the captain of the ship with regards to medicine. And so for me, I also juggled around with the different things in medicine. I thought for a while, maybe I want to do psychiatry, but similar to other pediatricians, I like hugging people a lot and I like hugging kids a lot. And in psychiatry, you're really not supposed to touch your patients that much. I thought about emergency medicine, but I think I just have a slower pace of being, a slower pace of working. And so I just really like the pace of pediatrics and getting to know kids from the time that they're brand new and little and their parents are pregnant with them to the time that they are teenagers and they're on their way to college. So I love every bit of all of that. I just love it so much. So that is why, for me, I chose pediatrics and medicine.
I can go next. Can everybody hear me? I had some troubles with my Zoom. I actually had never thought about going into medicine until I was 18. I have always liked working with children. So as also Elena mentioned, I had thought about going to psychology or maybe teacher, but then I started volunteering at a pediatric hospital when I was 18, between high school and college. And I really liked how I felt in the hospital environment. So that kind of woke up this calling for me of medicine in general, because I don't have any family members that are doctors. I had never thought about medicine, and I really started looking into it. And the more I looked into it, the more I knew that was my calling. Then throughout the career of medicine, I changed a couple of times in terms of what specialty I wanted to do, but I always went back to what brought me in the first place to medicine, which was pediatrics and my love for healing children. I did feel a lot of heartbreak kind of seeing sick children. So that's why I had second thoughts about pediatrics. But then I realized you have to go for the calling of what, breaks your heart. And that for me is seeing sick children. So I decided to go for pediatrics.
Thank you. Thank you so much, everyone. It's really great to hear all of your different reasons why you decided to choose medicine and pediatrics. Our next question is, what are subspecialties in Peds?
So that's my question. So the great thing about pediatrics is that it has every single subspecialty you could possibly think of. So basically anything that you can send an adult to, with a couple of exceptions, there is an equivalent to in pediatrics. So we have cardiologists, pulmonologists, nephrologists, urologists. So every body part has a specialty that you can pursue once you've done your pediatric training. It's usually 2 to 3 more years. Sometimes it's a little bit more research-based, but you can kind of subspecialize within the field of pediatrics. There are a couple of big differences. Obviously, your patients are smaller. A lot of the subspecialties deal with things that babies are born with. So while an adult cardiologist, for example, might deal with, coronary disease and strokes and hypertension, pediatric cardiologists deal more with congenital heart defects. So problems with the heart that the babies are born with that sometimes need surgical repair, sometimes don't, but they kind of follow these patients through their treatment. There's a couple of particular pediatric subspecialties, right? So developmental pediatrics is a Peds specific subspecialty, right? They're the doctors who kind of help us manage the care of patients who have developmental delay, who have autism, who have other, issues with their development in all senses. So, educational development, their abilities to walk, their fine motor, all that sort of stuff. And then there is another more Peds specific, which is the genetics metabolic subspecialty, which again does sort of cover everybody, but a lot of their patients tend to be children. So a lot of their patients tend to be children who have things diagnosed on their newborn screen, or they have, something that doesn't seem quite right. And so they kind of work it up to see if they have a genetic disorder. But other than that, I mean, there's a ton of options if you think that you want to do pediatrics, but you really like cardiology, really like neurology, put that together and have a very fulfilling career.
Great, thank you so much for informing us about different subspecialties in Peds. Our next question is, what type of cases do you see in a day? And everyone can answer this question.
I'll start off. In terms of my daily workload, most of the kids that I see, as I mentioned before, are teenagers. So typically they're coming into me because they feel like they've outgrown their pediatrician and don't want to be around crying babies as much. And then for some of them also, it's just more convenient because their parents are already my patients. and they've already had a chance to get to know me when they may come to visits with their parents and say, well, Mom, Dad, I want to switch over to Dr. Henry. Typically, my kids are coming in for sports physicals or just general physicals for back to school, and your run-of-the-mill upper respiratory things. They may have a cold, sinus infection, or minor injuries from playing sports, for example. And also sometimes with the teenage girls, if their parents discover that she has lost her virginity, of course, I end up doing the workup, the pap smear, and having those conversations about birth control. Outside of that, the majority of my patients are adults. So these kids' parents and grandparents, aunts and uncles. I have one family, I'm literally taking care of 3 generations of the family in my practice. So that's a typical day for me.
Hi, this is Dr. J. So I mentioned that I'm a house call pediatrician, so my day looks a little bit different. I practice in DC, Maryland, and Virginia, so I go to all different locations throughout the day. I do a lot of telemedicine, so my day could start out with telemedicine visits, doing follow-up with patients who have asthma or patients who are medically complex. And then in the afternoon or the early evening, I may do a few house calls. I have 3 children, so I kind of, with coronavirus, do everything in between the day. And even now, I'm double duty with the infant while on here. So I love doing house calls. If folks really like to, spend time in people's homes, house calls are one really fun way of doing medicine in a different way.
Ready? Oh, so I can go next. So like I said, sorry.
No, I was muted. I'll go next after you.
So I work in a general pediatrician office. So I work in the same place every day. I see, the same families of patients. My typical day is, 9 to 5, seeing checkups, seeing kids with, mild illnesses, sometimes not so mild illnesses, lots of coughs, colds, injuries, kind of sort of like Dr. Henry was saying, sort of the similar thing, except I see the whole range of pediatric patients. So newborns through usually college age. So once they either graduate college or they feel, like she was saying, that they don't want to sit next to the crying baby anymore, we kind of move them on to adult or family practice patients.
Hi, this is Dr. Aramburu. So my typical day, since I work at the school-based health center, I'm also seeing mostly adolescents ranging from 15 years old to 21 years old. And I also, like Dr. Kella, I'm doing a lot of sports physicals, minor injuries, upper respiratory infections, UTIs, STDs, doing a lot of contraceptive counseling, pregnancy prevention, and then I'm doing a lot of mental health. So half of my practice has become mental health, and I even started doing like a mental health day where I see all of the teens that have depression, anxiety, or PTSD, which is a lot, and I collaborate closely with psychiatrists and therapists to create a plan for these patients. So it's very interesting, but also very hard sometimes, but I like it.
Great, thank you so much. Our next question is, how do pediatricians differ from family medicine doctors in scope of practice?
Well, that's my question. And as I mentioned before, basically the big difference is that as family practitioners, we see adults in addition to seeing pediatric patients. Now, it depends on the practice. For me, the majority of my patients are adults, but they're bringing in their children to see me as well. Some family practitioners, though, have a pretty even split of pediatric patients to adult patients, and then some actually lean a little bit towards a pediatric practice, and you almost can't tell the difference between them and a pediatrician. But I and my partner made the decision to just see children starting age 5 and up, because to be perfectly honest, at that age, they can follow directions and understand what I'm saying in terms of, okay, open your mouth so Dr. Keela can see, take a deep breath like this, and what have you, whereas babies can't talk. So that's why we made that decision.
Great, thank you so much. Our next question is, what's a typical day in the life of a pediatrician?
Oh, I can go first. So, I think everyone, it kind of depends on the place that you're practicing and what your focus is. A typical day for me generally is, like I said before, 9 to 5. I generally show up at the office somewhere between 8:45 and 9 o'clock to log into our computer system, take a look at my schedule, touch base with my nurse. And we see patients 9 to noon. Pre-pandemic, that was a good mix of checkups and sick visits. Now, during the pandemic, we've changed the way that we have patients coming into the office, and we do just well visits in the morning to try to minimize unnecessary exposures, right? So I'm seeing, checkups, everything from newborns coming in from the hospital to teenagers going off to college or going off to live their lives. And then we, have a lunch break where we, eat lunch and relax and catch up on any of the paperwork and the stuff that we need to kind of handle, check labs, call parents back. And then the afternoon is pretty similar. So, 1 to 5, again, mix of checkups and sick visits. Now with the pandemic, we've separated them. So we really only see sick patients in the late part of the afternoon so that we can fully sort of decontaminate the office before we have well visits coming in the morning. But, it's kind of, one of the reasons I like it is because it is kind of a 9 to 5. I get to come home and just spend time with my family and not be overly plugged in and have to chart and do lots of call and stuff. So for me, it's worked out really nicely.
I think this is Dr. J. So I just want to also share about some of, the administrative burdens of being a pediatrician. I think we have a good range of people in different practices talking to you all, but something to definitely consider as you, begin your practice and begin to decide where you want to practice is how much administrative time you will have. How much time it takes out of work that you may have to write notes. I think all of us can attest to how difficult it can be sometimes to balance work and life. And so being in a supportive environment is really important. When you start going through your rotations, you'll see, some of us in certain practices, you can see up to 35 patients a day. When I was an employed physician working for a hospital system, I would go in the morning and I'd have 35 patients scheduled. That is a lot of patients to see. It is very hard, and it can increase your burnout a lot, amongst physicians. So my days now doing house calls, I never see more than 3 patients in a day. I get to control that because I run my own company. I started my own company because I wanted to practice in a different way. So I think it's important too to know that a lot of your day, a lot of doctors in medicine, a lot of our day is spent on the phone with pharmacies, spent finishing our notes, spent talking to insurance companies if we accept insurance, trying to get things covered for our patients that aren't covered. So that's a lot of the day, and that stuff is not, that stuff is not sexy, as they say. That stuff it's just the nitty gritty bones of medicine. And so we try our best to be as efficient with that as we can, but it's a significant portion of what most of us do in medical practice. And it's just the day-to-day stuff. So that is a lot of of what we do.
Thank you so much for describing a real day in your life. Our next question is, how is the lifestyle in pediatrics different from other specialties?
I can take that one. So in pediatrics, usually pediatricians are part of a group practice. So usually, for example, taking call might be different than other specialties. Because in pediatrics, usually if you're in an outpatient setting, you take call you're calling, answering the phone, taking parents' concerns, and then sending them into the hospital if they need to be seen. And mostly you're doing your, as I mentioned, 9 to 5, 8 to 5 schedule. And it varies also depending if you're in private practice or academic medicine. If you're in academic medicine, you might have some time for teaching, research, and administrative duties. And that allows you some flexibility in your lifestyle, but also makes you maybe be more busy some other times where you have an increased burden on that. And then in private practice, you might be able to do like a 4-day week sometimes, and then have like a day off versus the administrative time that you have in academics. And then the volumes vary. But the lifestyle, I think it is a good specialty for finding balance with family, because it's not a specialty where you would have to go into the hospital for an emergency, like surgery, for example, or other subspecialties of surgery where you're in trauma, they call you, you have to be in. As a mom, that'd be really hard. You would have to have, help all the time. So that's a difference with pediatrics and other specialties. And then, I think within pediatrics, you can choose if you want more the frame of taking call inside the hospital. So that would be like the hospitalist, the ICU doctors, and like the ER doctors. So those would practice shifts in the hospital. And then the lifestyle there would be they do 2 or 3 shifts a week, and then they have some time off. So I think within pediatrics, you can pretty much choose what type of lifestyle you want to have. But I think it varies for person's personality.
Thank you. What are some misconceptions about pediatrics?
I can take that one too. So I think some misconceptions that I've heard about pediatrics is, as Elena was mentioning, when I first decided to be a doctor, a pediatrician, there were people were saying, well, you won't be able to have a life because you always have to be on call for your patients, and they call you 24/7, and how you're going to take care of your kids. And really, it's evolved to be a very manageable specialty, because if you're in a group, you take turns taking call. If you're in a solo practice, that might be different. You might have to be 24/7, but then you have maybe less patients, and you can choose to do it a different way. I think other misconceptions can be that, pediatricians are making a lot of money, out of vaccines, or making a lot of high salaries. And it's actually one of the lowest paid specialties. But, we have other rewards, which is we have the best patients.
Thank you so much. And I definitely agree. You do have the best patients. The next question is, what personalities or qualities work best in pediatrics?
I guess I can take this. This is Dr. J again. I think you have to love kids to do pediatrics well. I think you have to love children, and you have to love working with families. Because we see children from newborns all the way up to most of us to the age of 22, you really have to enjoy working with a broad range of personalities and skills and aptitudes. The things that you use to work with a newborn and get a newborn engaged are completely different than what you're going to use to have a teenager engaged. And I think most of us love all of it. Some colleagues love teenagers more, or some colleagues love newborns more. And that's one of the good things about pediatrics. You can kind of choose the patients that you love the best and get the most referrals from those people. So you have to love kids. You have to, you definitely have to love children. And be friendly and smile.
And I think also be relatively easygoing, because nothing will go according to plan when you go in to see patients, because they're kids, and kids don't, follow the schedule that you've laid out. And sometimes things can be more complicated, or, they're crying, or they're pooped, or they're, vomiting all over you. And you just have to kind of be able to go with it, because if you really get hung up on some of those things, then you're just not going to enjoy this field. I think you have to remember that it's fun. Kids are great. They're, they love everything, and they can teach you so much. And so as long as you're willing to kind of to know that and know that things might, you know, not be as expected. I think that that's important too.
Would anyone else like to share a little bit?
Well, I can pretty much piggyback off of what Dr. J and Dr. Elena said. I mean, you do have to love kids and love working with families, hence the name of my specialty, family practice. And I would definitely say I prefer working with our teens. One of the things I do when teenagers come in is ask them two things. One, what did you get on your last report card? Because I'm a big supporter of education. And then two, what do you want to do when you grow up? What would you like to be? And one of the things I've noticed is that young ladies give me a variety of answers. I'm just so encouraged by this generation of youngsters who are coming up. I hear young ladies tell me, I want to be a nurse. I want to be a pediatrician. I want to have my own fashion line. I want to go into law. I want to be a teacher. Young ladies definitely want to serve. And so I take that opportunity to really encourage them and let them know, look, you can do and be whatever you want. And I think we need to be encouraging and inspiring. I mean, obviously, kids grow up with their parents having their backs and saying, I believe in you, sweetheart, or I believe in you, son, and you can do whatever you want. But sometimes I think, especially with teenagers, they're like, well, mom and dad, you're supposed to tell me that. I'm your kid. But it really helps to have someone, an objective third party like myself, to say, yes, you can do that. And here's how. Especially with the patients who come in and tell me that they want to go into medicine, I'm just really gung-ho about that. And I tell them exactly, you know, what they can do. Pre-COVID, for students who wanted to shadow, I have quite a few colleagues who I went to medical school with in Philadelphia, and a group of us have landed here in the Atlanta area. So I would contact some of my colleagues who are in different specialties and say, hey, I have this patient who is interested in orthopedics, for example, or who's interested in cardiology, and I could help them out and direct them to my friends and colleagues for those opportunities.
Great, thank you so much for sharing. Our next question is, what are the most rewarding aspects of pediatrics? And everyone can answer this question as well.
Well, for me, seeing my pediatric patients grow up. I have quite a few. I've been in practice now almost 18 years. It'll be 18 years in January. And I've been taking care of some of my patients since they were kids in like middle school, and now they're adults. And so that's been really rewarding for me. And then also sometimes I've had kids come back and say, you remember you said this to me, Dr. Henry, or you said that? And of course, I may not remember because I've seen so many patients over the years, but it really warms my heart to know that I've said or done something during my interactions with my patients that actually made a positive impact on their lives.
Yeah, I mean, I'm exactly the same things. I love watching babies grow up. I've been at the practice I'm at now for almost 10 years, and I have patients who I saw as newborns who are now about to go into middle school, and it's amazing to see how their lives are sort of developing right in front of my eyes. I think the nice thing about pediatrics, as opposed to some of the subspecialties, is we generally see healthy children. Even the kids, when they're sick, they're not that sick. And so you get to really focus on the positive changes that you can make in their lives. You know, counseling about, you know, exercise and healthy eating, and counseling parents to stop smoking because their kids have asthma, all these things, and then really sort of see how that manifests as the kids get older. And similarly to what Dr. Henry was saying, like, you know, telling parents and telling patients things and then having it come back years later where they're like, you remember how you said that we needed to XYZ? Well, we did, and now, yeah, now look, and you're like, oh, wow, that's amazing. So I think for me, it's the longevity of pediatrics that I find really, really rewarding, and the kids, because they're great.
I totally agree. And I just want to piggyback on that. You know, so many of us, since this is our calling and what we were called to do, we really respect and value the importance of it, right? There is so much importance on the doctor-patient relationship. And I don't know about many of you, but like when I was growing up, I had some bad experiences with doctors sometimes, with doctors being rude or being abrasive or not listening to what I had to say. And so what I'll say is every single interaction that I go into, I think it's so important to make sure we're being respectful of children and their autonomy. Make sure we're respecting, you know, differences in gender fluidity, socioeconomic class, like all of those things. And so I find it very important to make sure that the first interactions that children have with doctors, they should be positive, especially because so many children see so many different doctors, right? Their insurance changed, so they have a doctor for a year or two. And then 2 years later, they see someone else, or maybe their parents move. So each interaction we have with them, it's extremely important, you know, that we're leaving them with a good experience. So then they can continue to have good experiences with doctors moving forward. Yeah, I think that's really important.
Mm-hmm. Great, thank you. Our next question is, what are the most challenging aspects of pediatrics?
To piggyback on what I said, I think one of the most challenging things for me is when children or families have had a negative experience with doctors in the past. You know, there are a lot of constraints on doctors these days. You know, many people who work, you know, in practices and, you know, insurance companies, and your clinic administrator is telling you how fast to go, telling you to work faster, telling you to see more people. So what I find one of the most challenging aspects can be just to make sure I slow down, give everyone a good experience when they're with me, talk to them, allay any fears they may have. You know, I've had especially teenage girls or teenage boys, they may be nervous to talk to us about things that are confidential. So I think the challenging aspects are making sure that in the moment you're present with the patient and giving them everything that they need. When I was employed before, I would only have about 15 or 20 minutes per interaction with patients. But now that I run my own practice, I get more time. So I love being able to slow down and take some of the challenge that before was having to go super fast and just being able to go slow with people.
Mm-hmm. Yeah, I totally agree. As an employed pediatrician, I find it challenging sometimes to fit in everything you want to discuss in that 15, 20-minute slot, you know, especially with the teenagers who have so much going on. And I think right now with COVID, there's sort of that extra level of stress and anxiety and uncertainty. You know, being a teenager is hard, and being plugged in as a teenager is very challenging. And now with COVID, it sort of adds this extra element that is hard to assess when you only have 15, 20 minutes. For me, I think one of the most challenging aspects of pediatrics is the family dynamic. So every family has its own dynamic and their own belief systems, and trying to navigate that in a way that is sensitive and, you know, respecting that, but also providing information that is evidence-based and, you know, science-backed can be challenging. And, you know, our parents are very educated now. They do a lot of research, but they don't always do the appropriate research. And so sometimes trying to tease out what the real concern is can be a bit of a challenge. And then, you know, the fact that most kids can't really tell you what's going on can be challenging. Trying to figure out what's going on with the 2-year-old, you know, who's crying, and you don't, that can be hard. So you really have to be able to have some patience when it comes to both families and the patients themselves, you know, and trying to really figure out what is going on. It's challenging. It's rewarding, but it can be challenging.
And I agree with Dr. J and Dr. Elena. You know, making sure that your patients have a good interaction with you, especially if they've not had a positive interaction with previous doctors. Also, trying to manage family dynamics. And then for me, also, I wonder if I've been able to fully reach the patient and their family. Like, did what I say make sense? Did they truly receive it? or are they just saying, yeah, and then go home and not fill the prescription or not follow up on the treatment plan that I've recommended. So sometimes I think I carry that emotional burden with me, you know, just worrying about whether or not they truly received what I had to say.
Yeah, really. Thank you so much for sharing the both sides, the most rewarding and the challenging aspects of pediatrics. Our next question is how to match into a good pediatric residency.
Okay, I'll take this one. Even though I'm FP, I think what I'm going to say probably applies to pediatric residencies and any residency. Research, relationships, and confidence. You know, once you are at that stage in medical school when you figured out that you want to go into peds or family practice, whatever your specialty is, do the research. Which residency programs are the best in that area and they have a great reputation? And then also building relationships. It's important to build relationships with people. You need to stand out when you're doing your rotations. You need to stand out as a medical student because of course that increases your chance to matching into a good residency, and then have the confidence in yourself that I can do this. I can get in here and be the best doctor and the best that I can be.
I guess I can go next. So first I wanted to just kind of unpack what this means by good residency, right? Because the ACGME makes it so that there can be very little variations in residency programs. They all have to hit many of the basic same things to be accredited programs. So you want to make sure you're in an accredited program, right, by the ACGME. But then within that, I think being close to family is important. So it may not be number 1 or number 2 or number 3 residency program, but it may be a really good fit for you. So I went to UNC Chapel Hill, and even though it's a top tier program, it wasn't like number 1 or number 2 in the country. But for me, you know, it was very important to get a broad range of experiences. So you need to think of like urban, suburban, inner city versus rural, and you're going to get a lot of different experiences in that from your residency. So for me, like I said, it was really important to make sure that I got to see a broad range of things. So being that I did my residency at a community hospital, my first week of residency, I ran my own pediatric code, like cardiac arrest on my own, like because my senior resident was running the intensive care unit. So in a program like that, I was able to see many more things. If I had done residency in a city, I have a lot of friends who graduated and didn't start running codes or doing any of the intensive care management that I did early on until later because of all the subspecialists they have. So by good program, I think anywhere you end up, it will be good as long as it's accredited and you talk to the residents and make sure that they're supported. But I think it's really important for you to think of what you need from a residency. If you think you're going to go and practice in a big city, then go to a big city and do your residency. But if you think you may want to run your own company or do something else later where you need to have a broad range of experiences and exposure, you should think of some of the smaller programs. So I think most programs are going to be good, but you need to think about what you want and what you need and where you are the most comfortable. And then I always tell my students, because I teach at George Washington University Medical School, that they also need to think of where their seat of power is. So are you better when you're close to your family? Do you need your mom's cooking once a month or you will not be okay? Like you need to think about those things. If your mom is in New York City and you're thinking about going all the way down to New Orleans and you know you're going to be miserable, do not go, even if it's the top program in the country. You need to think about where you are going to thrive and flourish as well.
Yeah, just to piggyback on, I mean, that was totally, when I picked my residency program, I made a list of the pros and cons and all that ranking and all that stuff. But in the end, it was a gut feeling of what the place that was the right place for me. And my family lives abroad, so I didn't have the option of being close to them, but they are only a 2.5-hour flight from Miami. And so when I went to the Miami program, it's a huge inner city urban hospital. There's 40 residents. They're super busy. It's the trauma center for all of Latin America. And so I walked in there and was like, nope, this is not for me. Like, I cannot handle this. This is not where I want to go. And, you know, I looked at schools in Texas and California and Chicago and everywhere because I wasn't really sure where I wanted to be. And in the end, I ended up here in DC. A big reason because it was a small program. It had a very good community pediatrics and general pediatric program. So you can go on a track that sort of fed you into general peds, which is what I knew I wanted to do. Had, you know, some interesting subspecialties that you don't see in other places. They have a transplant unit, which is amazing. But I also have friends in DC. And so a lot of my friends from high school had relocated to Washington. And so I knew that I wanted that would be good for me to have that sort of outlet outside of the hospital, because I knew I was walking into, you know, 3 years of a lot of nights and weekends and being very tired, and to have people that I already knew I could go and hang out with if I needed to on a Sunday afternoon, you know, no judgment, that was really important to me. So I totally am on board with what everyone's saying, but especially that good is relative. You know, I had friends who went to all sorts of top tier schools who loved their programs, and I've got friends who went to very small programs and they loved them too. And so it's really what you know. And I feel like when you go through the process of interviewing, you'll know. Like you walk into programs and you're just like, I don't know. And you walk into places and you're like, I love it. And then you walk into programs you might love, but you don't love where they are. So I definitely interviewed at some places where I adored the program. It was perfect. It had everything I wanted, but it was in a city that I just did not think would fit me. And so I, unfortunately, you know, or fortunately, had to say, well, that's just not for me. I don't want to live in, you know, wherever. So that's it.
Yeah. Thank you so much for explaining the things we should keep in mind when we're looking to apply into a residency program. Our next question is, how has the coronavirus altered your daily routine as a pediatrician?
All right, I'll start. The biggest thing is the switch to telemedicine. I've been doing a lot more telemedicine, which I had not done prior to COVID. And initially, the number of patients I was seeing in the office, dropped drastically. I was seeing anywhere from like 15 to 20 patients a day. And then that dropped down to like maybe 5 until our practice really got online and up and running with the telemedicine. So around the end of July, I started seeing my physicals, my healthy physicals back in the office again. And so now we've set things up where my patients that need to be seen in the office, typically I'm seeing them in the mornings. And then in the afternoons, I'm seeing my telemedicine patients. And my patients really appreciate it, because for quick things like just medication refills and follow-ups for some of my patients who may be dealing with emotional issues like depression or anxiety, they don't necessarily have to drive all the way to my practice for that. We can do it this way virtually. The other thing is, of course, we've set up the practice where everyone is getting scanned for their temperature. The staff as well as the patients before they come in, we're separating them. So I don't truly have a waiting room anymore. Pre-COVID, we had a nice little coffee and tea station. And of course, that's been completely shut down. And also, we don't allow visitors or anyone with our patients, with just a few exceptions. Obviously, minor children have to have a parent present. And if any of my elderly patients who maybe have dementia, or they are disabled in some way, they're in a wheelchair or need assistance with walking, then they could have an additional person. But when we would have, for example, just a husband and wife come in together, that's over with. If the wife is being seen by me, the husband has to wait in the car, or vice versa. So those are some of the big changes that have happened at my office.
Yeah. Similarly, our office kind of went through the same thing. So when COVID hit and all the shutdowns started, we went from seeing on average 20 to 25 patients each in a practice of 10 providers to maybe 20 to 30 patients total in a day. So, reduced our hours. We went to telemedicine. It was a very uncertain time. And I think for me, it was interesting because I had never considered medicine to be to be uncertain, right? I felt you're a doctor, you're always going to have work. And now it was like, well, maybe, if things continue, there was talk of closing the practice. I mean, it was a whole mess. Eventually we shifted to a similar schedule where we see checkups in the morning and we see checkups and non-sick visits. So kids with rashes, kids with ear infections, with no fever, that sort of thing, in like a second block. And then we see the fevers and the coughs and everything kind of later in the afternoon with a deep cleaning between, periods. We started doing telemedicine. We had someone on telemedicine every afternoon till the beginning of this month. And they're figuring out if insurances will continue to cover telemedicine, because we have a lot of state insurance and whatnot. Similarly, we screen everyone before they come in. We've limited the number of people in the rooms with exceptions, right? So newborns can come in with both parents. Ideally, we want one parent and kids, but we understand that a lot of our patients don't have alternative childcare, so they can't leave their 3 other kids at home to bring in this one kiddo for XYZ. And so as much as we want that to be the reality, it isn't. We have, families coming in all together, all 7 of them in the rooms, and what are you going to do? But yeah, it's definitely been different, and I'm curious to see how it's going to go forward. If this is just going to be the new reality in pediatrics, or if things will slowly sort of go back to the way they were. I don't know. We'll see, I guess.
So I guess my practice is a little bit different than the other 2 docs. Since I do house calls and telemedicine, I've been doing it since I opened up my practice. I knew that most families really wanted telemedicine because it's just, they want to be able to text you. They want to be able to have a quick video. And so that was always a part of my practice when I started my practice last year. So for me, I didn't have to pivot that much because my patients all already knew how to video me. They already knew if you send Dr. J more than 2 texts, she's going to ask you to hop on a video so she can see what's going on. So that didn't change. But what did change is actually I got more business. So I kind of am flooded right now with an influx of people who want a doctor who's going to come to their house and they don't want to go to a practice. So I actually have a waiting list every single month of people that want to see me and have been looking to bring on an extra doctor very soon. So it's been great. I will say as a business owner, I've had to purchase, I purchased all of my own protective equipment. I purchased my own gloves. There was a back order on gloves. So like little things like talking about the uncertainty that you never knew. I never thought like I would order gloves and they wouldn't arrive in 2 days. Like I've ordered gloves 4 months ago and they still haven't arrived from my manufacturer. But I got them from other places, like other, friends who own practices would send, we share things and they'll send you a few boxes. Or I have a patient who got like 20 boxes of gloves at the beginning of the pandemic because she knew what was going to happen. And so when I go to her house and see her, she brings me 4 boxes of gloves. So for me, it's been increased costs of personal protective equipment, but also increased business, with more and more people being interested in the practice.
Thank you so much. It's really interesting to hear how COVID has really affected all of you and like how it's affected you like differently. Our next question is, how has medicine changed since you started practicing, and where do you see it going in the future?
All right, I'll start with this one. I remember when I was doing my residency and internship training, initially there were not drug ads on TV, and then that changed. So I know that's probably weird for you guys to think, what? They didn't have commercials on TV for these medicines? No, they didn't at first. So that's something that I've seen change just during the time that I've been training and practicing. The next thing that's been different, when I first started in practice, we had charts. We did not have an electronic medical record. And then, of course, the government got involved and kind of mandated that we do that. And so we had to switch over to an electronic health record. So medicine has become a lot more digitized. And of course, social media. I was not on social media back in the day. And now, I mean, you have to. This is how you young ladies found me, is via social media. That's been a change. And also the other thing is patients think they know a lot more than often they do because of these websites, and they can get a hold of information and come in and think they can diagnose themselves. I read this online, Dr. Henry, and I think I've got such and such a disease. They look up their symptoms, and at least once a week, I've got someone who swears they have cancer. I'm like, please do not do the doctor Google. Leave the doctoring to me, please. In terms of where I see medicine going in the future, a couple of things. One, it's just going to become more digitized, I think. And in terms of like Dr. J's model, I think we're going to see more kind of like concierge medicine models. And then the third thing, I mean, I'm currently an employed physician. And one of the things that's happened in the past 18 years that I've been in my market is more and more hospital systems that are merging and combining and forming these big conglomerates. Mm-hmm. Now, Emory has been a big conglomerate since I've been here, but they actually purchased my practice. My partner and I have been practicing together for 16 years, and then the whole medical paradigm shifted. And it just really wasn't advantageous for us to try to fight the big Goliath by ourselves. And so we joined up with Goliath, so to speak. Because when you're out there as an independent practice, I don't know how many of you are football fans, but it's kind of like the Atlanta Falcons quarterback, Matt Ryan, going up against the New Orleans Saints all by himself with no linemen or any backup. So you've got to get a team around you if you're going to be a primary care physician these days.
I agree completely with everything that you just said. Mm-hmm. So changes that I've seen, we've always had electronic medical records, but there is increased competition, especially for general practitioners, so general pediatricians and general family medicine physicians, from nurse practitioners and from physician assistants. In many states, they can practice completely independently. They don't need supervision anymore from docs like us. And I love my nurses, I love my PAs, but I want my family to be seen by a pediatrician. I want my family to be seen by a family medicine doc. I want my family to be seen by an internal medicine doc who has gone through a residency program, has done all of those clinical hours. I'm not going to get into it because there's like a big cultural war going on right now, and I don't want to offend anyone, but who do you want your family to be seen by? Other changes I've seen are increased burnout amongst physicians. I talked about when I was an employed physician, having to see 35 patients when I would walk in the door. And I remember just feeling this like dread and this doom because I knew I cannot do a good job in 10 minutes. I can't do a good job in 15 or 20 minutes. Like, it's just too many things to do. And so that is why, I started my own practice. Other things that I've seen is more and more young docs wanting autonomy, folks saying like, I want to be able to hang out with my family in the morning and go out to my garden and then see my patients. But, doing it in a way that's sustainable and that you can make enough money to pay back all of your loans. Is important as well. I see people going more and more into debt to become physicians. So if you can go to your state school, if you can go to, a school that maybe doesn't have the biggest reputation, but you don't end up with $500,000 worth of debt, like some of us have, be very cognizant of that. Be very careful of that, y'all, at your stage in the game. And I've also seen a lot of outside influence from insurance companies. We just talked about like how, hospital systems are merging. But another thing that needs to happen that I want to see in the future is that as these hospital systems merge, that doctors also merge and doctors also advocate for one another together. The nurses unions, they are powerful. And I don't know any physician unions that are as powerful. I know that physician unions are popping up, but unless we all start working together, like, we are going to get left behind. I don't know if you all have seen, but there have been so many reports, especially during the pandemic, of physicians just being fired, like big groups of physicians being fired and nurse practitioners being brought in because the hospitals can pay them less, like much less. Like if doctors work together in their and make it so in their contracts so that that can't happen, that is super important for us moving forward. So as you all are thinking of going into medicine, I really want to encourage you all to think of how you can collectively bargain and collectively work with other physicians to make sure you have job security. Because, you know, like Dr. Elena mentioned, like practices are closing left and right, and physicians are now having to go out in the workforce and find jobs where there just aren't any. You know, I was a locums doctor, which are like temporary doctors in a practice for a long time. Those have all like, that's stopped. Like people are not looking for temporary doctors just to fill in. So moving forward, you guys, I really want to encourage you all to work together with other physicians to make sure you have job security, make sure you have the quality of life you want, make sure these administrators are not asking you guys for things that are unattainable to give. I think that's important. And if anybody's interested in direct primary care or concierge medicine, you know, you can talk to me about it. I know that sometimes there can be a bad connotation about it because people are thinking that only rich people can afford it, but that's not the way that a lot of us have set up our practices. My practice is very affordable for families like mine. Like I wanted people to be able to attain it. And so a lot of us are working to make sure that it's attainable for the average family. And I offer some bartering care and free care too.
Awesome. Thank you so much for sharing the way medicine has changed. How do you recommend doctors stay on top of medical advances?
So I think that's one of the biggest things that doctors need to do. So part of our responsibility as, you know, MDs is to stay on top of what is going on in medicine, not just in your field, but kind of across the board, because you will get questions, especially in pediatrics, from parents about their care. They'll say, hey, I saw my doctor. He said this, he said that. What do you think? And if you don't have any idea sort of the different advances, then you're going to be like, even though you should always really say, refer back to your doctor, don't answer unsolicited medical questions. But I think it's really important to know where your specialties guidelines are and where they're being updated. So for pediatrics, the American Academy of Pediatrics puts out guidelines, which are just recommendations based on evidence for everything. And it's now with the internet very easily accessible. You can find everything. And it's your job to kind of, you know, read the medical journals, read the new advances, read updated guidelines so that you are offering care that is as up to date as it can be. And it's, you know, it can be a full-time job to kind of keep on top of everything, but I think it's important. It's a very important responsibility in medicine to kind of make that part of your life and your practice.
I want to piggyback on what Dr. Elena said. Yes, we need to read and make sure you're a member of your specialties academy. So, you know, for pediatricians, it's the AAP. And then for me, it's the American Academy of Family Practice. Also attending CME events, which stands for Continuing Medical Education. That's a great way to have doctors who may be more experienced and who are doing research to present the latest evidence and advances to you. And then you have the opportunity to ask them questions there in real time and also build relationships with them. I mean, pre-COVID, of course, typically these events were held in our cities at large venues, sometimes hotels and whatnot. And of course, post-COVID, I think a lot more things are being done virtually now. But again, they're just like this. We're able to ask questions and get the latest and most updated information.
Great, thank you so much. Our next question is, how do you become a good doctor? Tips.
I can take a stab at it first. I think becoming a good person is a good way to start. I think a good pediatrician is someone who, first of all, is taking care of themselves. So I think it is extremely counterproductive to tell our patients or encourage our patients to do things that we ourselves are not doing. So, you know, I teach medical students, and often one of the most common things I have to tell them to do is like, are you sleeping? Did you eat any fruit today? Did you eat any vegetables today? When's the last time you got exercise? When's the last time you saw your loved ones? Like, you know, it's going back to those basic things. So I think becoming a good doctor is becoming a good person and taking care of yourself, number one, making sure your family is taken care of so that, you know, when you are at work, you can be at work. When you are at home, you can be at home. Making sure you're getting enough sleep, making sure you're eating well. You know, there are multiple studies that show that doctors who feel better, doctors who, you know, themselves are not burnt out, that they give better care. Doctors who are burnt out, doctors who are overwhelmed, doctors who are suicidal, have less empathy, and they give less good patient care, and their patients actually have more complications. So it all goes back to us taking care of ourselves so that we can then pour into others and take care of others. So I think, you know, in summation, becoming a good doctor is about becoming a good person. And you're going to do such a better job if you are happy and healthy and whole than if you are broken and burned out and ready to quit everything. I think it's super important.
I think that's amazing advice. That's so true. I think another thing that is good to work on is being a good listener. So a lot of the times patients tell us things, but if you aren't listening, then you miss it. And it's because they're saying it in either the way they say it or their choice of words or their tone of voice. And especially for pediatrics, I think it's really, really important to really listen and, you know, validate parental concerns, because a lot of times parents are concerned about things that you as a doctor know aren't a big deal, but that doesn't mean that they don't matter to the parent. And so I think it's really important to take a little bit of time and let patients finish talking, right? A lot of times we tend to cut people off. You know, let parents tell you their whole story, even if it has nothing to do with why they're in, you know, or tell you about their vacation or tell you about this, tell you about that, because it helps build rapport. It also helps you give more information so that when you come back to why they're there, you have a little bit of more background to help you kind of come to the right, you know, diagnosis or give the right advice or whatnot. So I think practicing listening skills is a really good tip for doctors, especially if you're planning on going into primary care where there's a lot of talking.
Well, you guys summed it up perfectly. I don't have anything else to add.
All right, thank you so much for providing these tips that will help us become a better doctor and better person. This is our last question, which is, what advice would you tell your younger self or an aspiring doctor?
I would have told myself to get more sleep. I had a lot of late nights. Mm-hmm. And to schedule self-care, mm-hmm. Which is something that I do now. Every other Tuesday, I go to a local spa and get a massage, and I always feel so much better and so much more relaxed afterward. So making sure that I schedule some self-care time. And it doesn't necessarily have to be the spa. It could be, you know, going for a walk in a local park, going for a bike ride, going for a run, but making sure that we prioritize our self-care.
Yeah, I totally agree with that. That's something that I've sort of learned in the last couple of years, actually, that taking care of yourself in that way, you know, having time to yourself, doing what you like is really important in finding that balance. You know, when one goes through medical school and they go through residency and you're kind of at the beck and call of people above you, and then you're an attending and you're like, oh, this is great. And you kind of have all this time, but then, you know, life kicks in. And so since I finished residency, I got married, I became a stepmom, I have 2 toddlers now, I'm working full time. Like, it's very easy to get lost in all your other responsibilities. And I think part of what happens as physicians is that we are people who are, you know, driven to give back and driven to help others and driven to put others before ourselves, and learning that, no, you need to sort of stop and take care of you so that you can take care of other people is really, really important. And I wish it's something that I had kind of started doing earlier, because it's hard now to kind of make that my habit. But I work 4 days a week, and I've, you know, mentally decided that every 2 or 3 Tuesdays that, you know, I'm not going to keep my kids home with me. I'm going to send them to daycare, and I'm going to go to the spa, get my nails done, you know, sit around and read my books or do whatever I want, just because I need that time to just be by myself. And I think that's, you know, I think that's really, really important. And it will all work out. That's the other thing. I would tell myself that no matter the stress and, oh my gosh, you know, you did poorly here, you didn't go there, it all works out. You end up where you're supposed to end up doing what you're supposed to be doing. And you may not see that while you're living it, but have a little faith. And I think, you know, trust the process, trust it all. You will get, you know, you'll get where you need to be.
I agree with everything they said, but I'm going to add some logistical, get less debt, go into less debt.
Yes.
I did some Ivy League learning. I think they were wonderful experiences, but that Ivy League receipt is very hard, very difficult.
Yeah.
Very 3 months paying as much as I do in student debt. So, you know, my friends who went to state programs and, you know, for undergrad and state programs for medical school. I have a few friends who, you know, 5 years out had paid off all of their loans already from undergrad and from medical school. So wow. That is, you know, I wish I could say that I'm going to be paying for an awful long time. But it would have freed me up, right? To do, like, to maybe start my company a little bit earlier, or to be able to like hire more people initially, rather than go slow. And I totally agree with trusting yourself. I wish I had surrounded myself with more business owners early on, because in medical school, for example, like I never even thought that I would open up my own company, but I could have asked like some of my attendings who own their own practices more questions. So just ask everyone you come into contact with more questions than you think you should. And trust, I agree completely. Trust that you're going to end up where you need to end up, even if it's not what you envision. Like, I always knew I wanted to work at a big old academic center, and now I own my own company, and I think I'm so much more happy with that than I ever thought. So I agree. Trust that the universe is working for your good. And
just to add on to that, if you have access to a business class, you should take it, because the one thing they never teach you is that any business at all, and most of us will end up, you know, owning our own business or being partners in a firm, you know, and all this stuff. And if you don't know how to do any of the business stuff, you're going to be at a disadvantage when it comes to everything, negotiating your contracts, you know, doing overhead analysis, whatever it is. So, you know, if you're still, you know, in a place where you can take some basic business classes, I think that is something that will benefit you no matter where you go, no matter what specialty you end up in, where you're living. I think having some basic business knowledge is really, really useful. So you should do that.
And I also want to add, in addition to basic business classes, maybe some like leadership or communication, because one of the most difficult things so many young physicians, especially young women, have is like when we are direct and when we speak clearly, a lot of times it is not taken well. So I think I wish I had taken like a communication class or like a leadership course or something like that, to even know how to interact with colleagues and to know how to interact with, you know, the nurses on your team or the medical administrators on your team. Like, you know, all of those things, those are skills that you get, but they trip a lot of us up sometimes. Like, a lot of us get tripped up on those things. So some teamwork and leadership training, I think, will be helpful too.
Awesome. Thank you so much. And I would like to thank all of our amazing doctors for helping us better understand the field of pediatrics. So now we're going to begin our live Q&A session. The audience can type their questions in the chat box, and our pediatricians will answer them for you.
So there was already one question about non-traditional folks and folks with children for moms. So I had our first child when I was a fourth year medical student. And I've had a baby every single kind of, I guess, important part of medical training. So in medical school, and then I had a baby when I was a first year resident, and then I had another baby when I started my practice. So I think just having a lot of support is very key. The person in the question asked, you know, how you are successful with that. You've got to have help. You've got to have help at work. You've got to have help in your own life. So that could be a cleaning company that comes in every 2 weeks, or I have a friend who a cleaning company came in every week, even when she was a medical student, and still does. So I think making sure you get support to the maximum of what you can afford. And even if you have to give up, like maybe going out a few days a week so that you have that support, that is key. Because as you can see, I mean, when you're a mom, like they're just there all the time. And this one, she breastfeeds and she's just with me all the time. So get all the support that you need.
All right, we have another question. Someone asked, what is the major difference between private practice versus working in a large faculty?
Okay, well, I can take that one because that has been my experience. When I first started, my first year in practice, I joined a hospital-owned group, and we had several different family practice locations throughout our county. And so my partner and I were in the location in Beaufort, Georgia, which interestingly enough is only a few miles down the street from where I practice now, that I'm part of a much larger hospital facility. So we practiced together for like 2 years, and then the paradigm shifted. The hospital said, well, we're divesting ourselves of the family practice locations. You guys can buy the practice and run it yourselves or find another job. So my partner and I bought the practice and we ran it ourselves for 6 years. And then the paradigm shifted again. Now, being in private practice, obviously, this is where the business aspect of medicine comes in. And my partner and I, you know, had not taken business classes in medical school because we don't get the business aspect of medicine. So we really kind of had to learn on the fly. The big difference is we had to create a team. We had to have a team of folks around us. We had our bookkeeper and our accountant and our lawyers was setting up the corporation. We had to go to the bank and get a loan. And so, for example, the cleaning people and folks who were vendors for like our stationery, all of that we had to procure on our own and do all of the hiring and firing, unfortunately, of staff. But you had a lot more autonomy. So, for example, this is a small thing, but during flu season, obviously we would offer flu shots to all of our staff. I didn't take it. I didn't see the point of me taking the flu shot because I'm a doctor. I know how to prevent it. And I fell ill after taking it before. So I decided not to, but we offered it to our staff. Now that I'm part of this big hospital facility, we actually have to. We're mandated to take the influenza vaccine or our jobs are threatened. Another difference is now with being an employed physician, there's all of these other corporate layers that's there. So there are a lot more people. We have an in-office manager and we have a regional manager, and then we have a liaison for the doctors to the corporate leadership, whereas we didn't have all of that before. Basically with our meetings, it was me and my partner and our manager there in-house. So there are just a lot more moving parts when you are an employed physician versus when you're in your private practice.
Yeah, I just want to piggyback too that there are so many different practices these days. So this private practice versus hospital practice. There are community practices. There are federally qualified health centers. There are, I'm seeing a lot of health ministry sharing popping up in places where churches are actually providing health insurance for their members. And it's not even health insurance, it's just, they just pay a doctor directly. So there are so many different and emerging payment models in medicine. I think once you all are practicing medicine, there's probably going to be things that we have never even seen. You know, when we look internationally at the way, you know, countries pay for medicine and do medicine. So I think that there will be a lot. And I get the flu shot every year. I believe in the flu shot. You see that there are differences in doctors and their opinions of, you know, medicine that they do. You know, my family gets the flu shot. My babies get the flu shot. I got the flu shot when I was pregnant. So, you know, different folks have different things that they believe. You know, I just want to add that.
Thank you so much. Someone asked, do you have any advice on how to make most of a gap year? Would any of you like to answer that question?
I didn't do a gap year, but some of my medical students did. What they found most helpful was doing something that they really believed in and not necessarily what other people thought that they wanted to do, right? Because I think you guys have a lot of things imposed on you, a lot of requirements that we didn't even have. It's much more competitive these days to get into medical school and residency than it was for us. So I think ultimately, you know, when I've been on admissions committees for residency programs, it's the people who could legitimately say that they did what they loved, and we could tell that they loved what they did, and that it wasn't just something that they put on their resume, right? So we can see through residency, through resume fluff almost, if you just did a research project because you felt you had to, versus if you did something that you really wanted to. So like my students who do what they want, whether that's research or volunteering with a program or being a scribe or working for a interior decorating company for a year or working for a marketing company for a year, you really need to do what's going to make you the happiest so that it comes across when you're interviewing. Don't do something because somebody says that you need to. But I guess if it doesn't have anything to do with medicine, maybe volunteering at like a medical clinic or something like that, just to always relate it back to patient care and improving your patient care skills. That's what I'll say as somebody who's been on like an admissions committee.
All right, thank you so much. Someone else asked, is there anything you wished you would have done / taken advantage of during undergrad?
That's a good one, because I was actually a part of our Health Careers Club. And in fact, I helped to design the logo for our Health Careers Club t-shirts when I was in undergrad. Maybe I would have taken advantage, or I shouldn't say taken advantage, but maybe sought out more opportunities to shadow a doctor when I was an undergrad. But, you know, of course, that may not be as helpful right now in the age of this pandemic, because I was doing, I was precepting some students, both nurse practitioner students and medical students in my practice before we were moved to our new location. We were in a town called Suwanee, Georgia, which is also north of Atlanta. And my partner and I we had a really large facility there, just the two of us. And so we had plenty of room for students to come and shadow us. And then we were moved to a different location and our practices merged with 2 other docs. And so there wasn't really as much of an opportunity to do that. And then unfortunately, when the pandemic hit, those opportunities just kind of went away. Perhaps as things, I guess, change and evolve, there may be more kind of virtual, I guess, opportunities that come up. Perhaps you could avail yourselves of those. That's the only thing, I'm sorry, that's probably the only thing I can think of right now in terms of what you guys can look forward to as far as undergrad and preparing yourself for med school and just doing some things that, you know, help you to become a more competitive applicant?
I will say I wish I had done more to assess my learning style earlier. So the standardized tests that you have to take to get into med school and that you take during residency, they are so hard, y'all. And I really wish maybe during undergrad, I had gotten like some testing done to find out the best way to learn because the mountains of information that they're going to require for you all to memorize and learn is really challenging for some of us. Like for my friends who had I have friends who have photographic memories. They can literally like read 400-page books, textbooks, and tell you what's on page 23. And I've never been that person. But I wish I had taken more opportunity to maybe take some test management classes or work with I guess educational specialists along the way, because it's really challenging. And then don't add having some children running around while you're trying to study for things. It becomes exceedingly challenging. So I wish I had done a little bit more of learning my learning style, learning how I learn best. So then I would be more prepared when I got to medical school to manage things, I will say.
Someone asked, do you have any tips on the MCAT?
Yes. Now, one of the things that was available to me in undergrad, there was actually a class called Special Topics in Biology that was essentially an MCAT prep course that all of us pre-med students could take. And I actually went to Spelman College. And so our brother school right across the street is Morehouse College. And the class was actually held on Morehouse's campus. So, but it was fantastic. And so if you can take something like this, with that class, we actually had like mock tests and we would practice. For the MCAT, you have, you know, your standardized multiple choice questions, but there's also a writing piece. And so we had to practice like how to write essentially an essay answering this question in a defined period of time. And so they had the timers there. We were learning the information, the different sections that were on the test. So if you have an opportunity to take something like that, or like one of the Kaplan test prep courses, definitely do that, because it gets you in the mindset of how to think and how to answer these questions relatively quickly, and how to get your thoughts together and put it together in a way that you make sure that you finish the test. It's a challenging test, but remember, you got to have the confidence you can do it. But it's best to prepare. Absolutely. And you can't, this is not a test you can cram for. Trust me.
Thank you. We have one more question left. Someone asked, do you have any advice on what opportunities should be taken advantage of before applying to pre-nursing programs?
We are all pediatricians and family medicine docs, so I never took any nursing courses. I will say that maybe a phlebotomy course would have been nice, since I do like all my own blood draws, or maybe like medical assistant programs are pretty short and pretty affordable. I think sometimes they can be like a few $100s, like less than, I think there's one in DC that like $600, but that might have been a good like thing to do during like a summer break in medical school. But I never took any nursing courses. I never thought that I wanted to be a nurse, so I can't really speak to that. But becoming a physician, I wish I had had more experience with like blood draws and starting IVs and doing things that sometimes nurses do, especially if you're in a big practice or in a big city. I think learning how to do all those things on your own so that you can do them on your own if you need to is really important in the changing landscape that we have.
Great, thank you so much. All right, everyone, that's all the time we have for today. I hope you guys enjoyed the conference and got to learn a little bit more about the field of pediatrics. Make sure to follow us on Instagram and our other social medias to learn about our upcoming conferences and opportunities. Also in the chat are our doctor's Instagram handle, so make sure to check them out on Instagram and follow them on Instagram. And again, thank you so much to our doctors for being here today. I really appreciate it. I hope you guys like this conference, and I hope to see all of you in our next conference.
I wish you one thing before you go. I wanted to let everyone who's attended the conference know, if you go to my Instagram page at Dr. Keela, everyone who attended the conference, if you're interested in getting my book, it is 40% off for you guys. Nia and the Numbers Game, A Teenager's Guide to Education, Relationships, and Sex. So you get a signed copy of my book if you're interested, and you can just click on the link on my Instagram page and also Facebook at Dr. Keela.
That is great, guys. You should definitely check that out. Again, I hope you guys enjoy this conference, and I hope to see all of you in our next conference. Bye, everyone.
Bye. Thanks for inviting me to participate.